Welcome back. In our health segment tonight, we explore options that empower every woman to take control of their health. We're talking about contraceptive tools that helps you plan your family, protect your health, and live life on your terms. And joining us for that conversation is Dr. Puya Jonah, a general practitioner at Wellness Medical Center. Doctor, good evening and welcome.
Yes, good evening.
Thank you so much for being here.
Thank you.
There's quite a large number of contraceptive methods available, but I want to talk about the ones that are, of course, available within Namibia and how they differ in terms of effectiveness.
Yes. We have different, maybe we can first define what is contraceptive or contraception. So it's literally the act of preventing pregnancy, okay, and we do that using different methods like barrier methods, okay, permanent methods. I'll just go into detail, hormonal, and then intrauterine devices and so on. Obviously, the safest method is abstinence. So that is 100% safe. And then we go to methods like condoms, morning after pill. Okay, so this is a pill that is used after sexual intercourse has taken place, at least within 72 hours. And there is now the oral contraceptive pills. There are also different types of them. We usually pick them according to, after we have assessed the patient, what would actually be the best oral contraceptive pills for them. And then there's also injectables. These are also hormonal. So a woman gets an injection like after every 2 or 3 months. They're also different types. And then there's obviously the implants. For example, the Levoplant or Implanon. Those are inserted in like the upper arm. And they usually stay, or they provide contraception for about 3 years. And then we have the patches as well. So which means this patch is changed every week for 3 weeks, and then there's a 1 week break where a woman will receive her periods, and then the cycle continues of these patches.
Just to interject there, what age can one consider you start using contraceptives, doctor?
Well, usually as soon as a young lady starts with her cycle. Most of the time we say as soon as the cycle is established, because some young girls can start their periods as early as 11, 12, 13, but one would say maybe as soon as they are sexually active, they should consider which contraceptive method can work for them. Okay, but then there are also other reasons whereby contraceptives, especially hormonal, are used like in teenagers. This is when they're experiencing very painful periods or heavy periods. Also, some of the contraceptive pills can assist with clearing acne.
So I've heard, yes.
Yes, yes. So it all depends, but then we usually assess the patients and see what is the best option for this young girl.
I want to talk about hormonal contraceptives and how they impact long-term health, such as, fertility or risk of disease.
Yeah, so in terms of fertility, there's really no proven data to say contraceptives maybe negatively affect fertility. So a woman should be able to fall pregnant after 2 or 3 normal cycles. Okay, so there's nothing really that suggests that it does affect fertility. But in terms of diseases, and this is one of the, let's say, the side effects, the possible side effects of contraceptives. So it slightly increases the risk of developing blood clots. This is what we call deep venous thrombosis and others. And it can also increase weight gain and certain cancers as well, especially after prolonged use of contraceptives over many years. Things like cervical cancer and slightly breast cancer. But as soon as a woman stops using that, then that risk drastically reduces.
Of course, there's so many options out there, and I think a lot of women struggle with choosing the best contraceptive method for them, whether they're a young girl who's just started their cycle or just become sexually active, or you've had a baby and now you need to change your contraceptive. Where can one go for contraceptive advice and choices, doctor?
Yes, so you should definitely see your doctor, whether it's general practitioner, or for more specialized cases, those can be referred to a obstetric gynecologist that looks into now those specialized cases. Let's say, for example, the patient has had previous episodes of blood clots, for example, then the non-hormonal intrauterine devices might work for this patient, or simply just sticking to condoms, because then the hormones can slightly increase their risk again of developing blood clots. So in this case, I would say it's not one size fits all. So your doctor will usually assess you, take proper history, and then usually discuss with you the options that you have available, and then and actually recommend what could work for you. But still, even if your doctor picks out, let's say she or he picks out pills, and the one starts to have some side effects like spotting, so bleeding between periods and so on. It's very important that we usually communicate this to the patients to say, these are the possible, after effects that you might have. If any of those happen, it's very important to just notify your doctor, and then they'll be able to deal with any of the possible effects.
Dr. Jonah, thank you so much this evening for educating us and being here with us. Thank you for your time.
Yes, thank you so much.
That was Dr. Puye Jonah, general practitioner, speaking to us on contraceptive choices. We'll be right back after this brief break.